We age because we don't move. Our body kind of goes through this use it or lose it kind of principle.
Chronic pain and stress can actually be mitigated if we're actually paying attention to the things that we actually need.
Movement is one of the fastest ways to keep us in this longevity state.
I'm going to go on the record and say stress in Black women is an epidemic.
So I would say pain is pay attention inside now. There's something going on.
What I love about the human body is that as long as you talk to it, listen to it, give it what it needs, it answers you back.
Taking small, actionable steps each and every day, a conscious choice to do something different for a greater result. We have to clear the brain out. We have to do things to bring our stress levels down if we want our body to heal.
Physical inactivity is the fourth leading risk factor for death globally. It contributes to 3.2 million deaths every year. And a 20-year study found that people who stayed sedentary had double the risk of dying early and nearly 3 times the risk of dying from heart disease. We hear all the time that we need to move more, but nobody is breaking down what movement actually does inside the body, how pain is connected to stress, and why the way you move today determines how long and how well you live tomorrow. That back pain, that stiff neck, those tight shoulders, that is your body talking. It's time we listen. That's why today I'm sitting down with Dr. Amber Jackson. She's a doctor of chiropractic, a clinical researcher at Life University, and an adjunct professor in the chiropractic sciences division. Her own journey started when a back injury as a college athlete changed the entire direction of her career. She doesn't just talk about movement, she's dedicated her life to it. We're getting into the real connection between movement, pain, stress, and longevity, why your body is sending you signals you might be ignoring, and what to do about it starting now. If this is the kind of conversation you need in your life, subscribe and follow so you never miss an episode. This is the Lushness Podcast. Let's get into it. Okay, welcome to the Lushness Podcast, Dr. Jackson. It's a pleasure to have you. I really want to open, the show with something that I think reframes the entire conversation way before we even begin. So a lot of us have been taught that with movement, it's really, something that we do when we want to lose weight, we're on a diet, we're counting calories, we're doing the things with movement and exercise and all of those things that we think are going to keep us healthy. But there's something a little deeper in the conversation that we don't tend to talk about. And that's what I want to discuss with you today about some of the chronic stress that is materializing in Black women. And in that chronic stress comes chronic pain. The body keeps score, and we know this for a fact. So I want to really talk about movement as medicine today. It is really important that we don't talk about it because when we think of movement, we're thinking that because we're working, because we're walking, because we're doing the little things that we do in our everyday life, that's movement enough. Or when we really hear that, okay, we want to lose a couple pounds or we're going away or we're doing those things, then we start to go ahead and focus on more movement to get to a goal. But when we talk about just living longer and how pain really starts to show up in the body based on the fact that we're not moving the way we're supposed to, and that chronic stress does tend to amplify in the body, allowing it to manifest into pain, I want to talk about how movement truly is medicine. So we don't want to think of it as something that we go to when we're ready to lose weight, but it's something that we want to do on a regular basis to keep chronic pain away. So let's talk about that a little bit. I want to talk about movement as medicine. What's your take on that?
Yeah, absolutely. Well, I'm so glad that you are thinking in this terms because I talk to my colleagues about this all the time with our patients. We think that we have to work out, we have to do a bunch of yoga or Pilates or whatever that is, which we should, but we should be daily moving. So that's not just getting the quote unquote 10,000 steps in every single day, but what kind of movements are we consciously doing to move our joints, right? So when we're walking, we're working our lower body, our hips, our pelvis, knees and feet. But what are we doing for the upper body? In addition to that, when we have tight muscles, it affects everything inside of our body. And we have a lot of joints. So we have to move all of the joints, not just some of the joints. Having a good mobility in our hips is one of the things that starts to age us faster. We've seen a lot more of an increase in, hip surgeries and knee replacement surgeries. And that's one of those things where people are like, well, if they're younger, they're 40 and 50 years old, and they're showing signs of osteoarthritis in their hips and their knees. A lot of that is because they don't move very well. And so doing very specific movements to target hip mobility and knee mobility, ankle mobility, we tend to forget about that a lot. Those are kind of the things that keep us moving and thriving each day a little bit better. I do a little bit of stuff in the morning and a lot at night. Before I lay down, when my body's in that most recovery phase, I want my muscles to be as loose as possible. And so I encourage my patients to do the same thing. If I ask patients, how do you feel when you wake up in the morning? Are you stiff? Are you tired? Do you feel like you got a good night's sleep? And a lot of times I get, no, I didn't sleep well, or yes, I woke up really achy and stiff. And so I encourage them to do something before they go to bed and then a few minutes before they wake up. Now, here's the caveat to that. It does not require some 1 hour workout every single day. It's small things that add up to a greater cause or greater solution over time. So if you take 2 to 3 of your favorite movements, whether that's a hip 90-90 or a cat cow, and you do that every single morning consistently, your body's going to thank you for that. It only takes 3 to 5 minutes. It doesn't need to be a long drawn out. If that's someone's preference, I'm okay with that. But a lot of people just aren't not moving in general. So if we do something that helps. When I think about the longevity, those are the things that age us. We age because we don't move. Our body kind of goes through this use it or lose it kind of principle, right? So when we become a couch potato or when we hit retirement and we're sitting on the couch every day and we're not moving around, our body goes, oh, I guess you don't need to move as much, but we do. So the more we move, the more active we are, our body still is like, oh, well, then I can make new cells or I can still lubricate these joints. And so we look at it from that perspective. I also like to remind people of the blue zones. Have you ever heard of those?
Yes, absolutely.
Yeah, I love the blue zones, right? I love studying them. I think they're absolutely phenomenal. We have a few here in the United States and most of them are kind of other places around the world. But the blue zones are centenarians. They're people that are 100 years and older. These people live in communities. Most of them are all 100 plus years. There's a few of the younger ones, 80s and 90s. But the centenarians, they're moving, they're gardening, they're exercising, they're getting down. We don't think about how important it is for us to be able to get on the ground and get up on our own. So that's what we see in these centenarian groups is their community, their lifestyles that are still keeping their bodies going each and every day. So movement is one of the fastest ways to keep us in this longevity state, right? To give us this longer health span and better quality of life, versus not sitting around and doing anything. So I love movement. I make all my patients move. I have patients who are in their 70s and I just had a new one start yesterday and she's like, honey, I don't do a lot. And I said, well, you're going to do a lot with me. I don't care if it's 78. Like I don't buy into that subscription of aging. How we feel is how we age. And so I do think it's awesome that on social media, you see some of these 70 and 80-year-olds and they look phenomenal. Yeah. They're doing things. And it's not because, oh my God, they're superhuman or they've just taken care of their body or they're moving more. So the more that we move, the more our body likes, but we have to be specific in what we're doing and not just doing anything. So that's kind of my take on movement.
That's amazing because to me, I strongly believe that the parts that you mentioned, the hip, the back, the neck, these are places where we start to feel the stress immediately. Mm-hmm. And of course, I'm going to be honest, I'm going to tell on myself, I don't wake up every day stretching my neck. I don't wake up every day stretching my hips. I don't target specific places on my body to make sure that I stretch every single waking day. Yeah. And I do know that for me, I just recently got into strength training and things like that because I learned how well that actually helps with perimenopause, and just making sure that our bones are doing well. I think they call it beating your bones, that I'm constantly beating my bones because it's important with the walking, with the strength training that I'm doing. I'm trying, but I do know for a fact that I'm not stretching and moving specific parts of my body. So tell
Hmm.
me, you have Black women patients. Am I
Yep.
correct? Like, you do have Black women patients. What are the things that you hear from them consistently, and why does it consistently show up in Black women? What is like a trend that you're consistently hearing, and what do you wish they would know?
Yeah, so this is always a hot topic for us. And when I have those patients in the office, we get into it's like having a therapy session. I think that we carry a little bit more of the weight of the world, right? We are a lot more empathetic than the rest of the population. We feel we've always kind of been the backbone of society in one strength or the other. If we're single moms, or even if we're married and we have children, or we're single, it doesn't matter. We strive to do more. A lot of us are excel. We're the most highly educated population, the demographic. And so we push ourselves really hard. We put a lot of that stress on ourselves, right? And I think there's some societal things that have pushed us in that direction. And that's kind of a rabbit hole we could absolutely go down at a different time. But I do think that we feel those stressors. I also think that we're undervalued and we're underheard. And so a lot of times we will go to our medical providers and say, hey, this is what I have going on with me. And we're either given okay, well, that's normal, or that's a part of aging, or that happens to everyone. And here's a prescription and you walk out the door. But that's not the answer in a lot of cases. I find that I have a lot of patients in that demographic that tell me they've gone to the doctor, they've talked to them about certain issues that they have going on, and they just have not been listened to. They come into my office and we break it down a little deeper and find out what's the root cause of what's actually what's happening with them, what's happening day in and day out, what are things that are stressful for them. What I have found is that more of us are leaning towards addressing our mental health, right? Having that balance, setting those boundaries, doing the things to take care of us. I know for me as a mom, I will, and as a doctor and a professor, I would do a great job of taking care of everyone, and then sometimes neglect myself off the strength that, oh, I've gotta fix my community or help that. But I've learned to take a step back and be a little bit selfish, because I cannot be the best version of myself to anyone else if I don't love myself enough to take care of me first. So I do give myself self-care days. I will make sure that I'm getting adjusted. I will take the time to stretch. I will say no. No is a complete sentence, and it's okay for us to say no. And I think a lot of times society has pushed us where we feel like we have to say yes to things, and we don't. We're deficient in minerals that we need to do better at. So
Mm.
sometimes we see that in vitamin D3. And a lot of us as Black women, we are deficient in that. So I highly encourage my patients to get metabolic panels, not your basic lab work. That's easy. We can look at glucose and insulin and all those things to make sure everything, our normal counts are fine. But the metabolic panels tell us what's going on with the minerals inside of our body. So
Mm.
functional medicine providers do a really good job at analyzing that and breaking that down. I feel like in research, we are not the subject matter, right? So
Mhm.
studies or things that we see where they're like, well, this percentage of the population experienced this type of side effect. My question is, were they Black women, or what were they? Who was the demographic? Because we're not built the same. And so it's okay to ask those questions and figure out what works better for us, because our bodies work differently than some of our other counterparts. And that's just science. It's not, anything more to it than that. So I love metabolic panels. I love kind of diving into that, knowing where my levels are at. I'm in the stage where I'm going through that perimenopause, and a lot of us are. And so our minds are already going crazy, right? And then you've got the state of the world happening. So it's so important for us to take the time. I love working with other Black providers, and not that I don't have colleagues and friends that are of other ethnicities and races, but we listen to each other. We have
Right.
very shared experiences. And I think there's a lot of powerful things that can happen when you work with another Black woman and she's helping you understand what's going on, because you feel like sometimes you're going a little insane. You're like, wait, what's this? Is everyone going through this? And I'm like, yes, everyone's going through this. So
Yeah.
it makes a difference. And, I just think that it's important for us to take care of our mental health and start at that place. and do more things. So I love seeing my Black whimsical girlies out here doing things and living life and traveling and exercising and really getting into their mindset and not letting, society push them to always have to say yes or things like that. We have to take better care of ourselves and look out for each other.
So, what I'm hearing basically is that if there's a trend of pain, if
Mm-hmm.
there's a trend of non movement, these are kind of the things that end up happening, right? Because we're not prioritizing our mental health. We're
Right.
stressing our bodies out completely. We're weathering at a rapid rate. And so our body is starting to knock on us and tell us, hey, you have to do something here, because what I'm definitely picking up is that chronic pain and stress can actually be mitigated. It can be mitigated if we're actually paying attention to the things that we
Yeah.
actually need. And that's pretty powerful because we don't think like that. We wake up in the morning, we're still in pain, and we head to the
Mm-hmm.
gym. But we didn't fix the mental problems. We didn't fix the issues that's consistently weathering our bodies, that's consistently stressing us out. And to understand that leveling out stress, that's, I really have to talk about that. Leveling out stress
Mm-hmm.
will actually bring the chronic pain
Yes,
down. and
absolutely.
and no one tells you this. No one tells you. Think you have to take some Tylenol. You think you have to go to the, of course, go to the chiropractor. We want you to
Right.
stay in business. Go to the chiropractor. But we can mitigate these things with, and it's so, I've been doing this podcast now, episode after episode, and every single doctor touches on stress in Black
Mm-hmm.
women. And I have to say that it's so important to understand that the stress levels in our body is chaotic.
It
It's
is.
it's an epidemic. I'm
Yeah.
going to go on the record and say stress in Black women is an epidemic. And so that's why I'm telling you, hearing that, I hope everyone that heard that understands that, wow, I could really stop feeling pain. And we're not talking like pain of things that are like, we're talking like skeletal, muscular, all of
Right.
those different things can actually come down when you manage stress levels. So I think that was a really good point that you made.
I always tell people how we think, what's happening in our brain. Our body is just a physical manifestation of what's going on inside of our brain. So we do a very good job of saying, I'm okay, or it's not that bad. You might have this shoulder tightness and you normalize it. It'll go away eventually, or I'll take something and it'll be fine. But I remind people, that's not normal. You don't have to live in pain. You don't have to minimize it or push it to the side. Like, you can address it and get rid of it. On top of that, the more stress we're in, the higher cortisol levels that we are producing, right? Our body's in constant sympathetic fight or flight. So if we don't calm our brain down, everything that's happening in our muscles is ready to react. We're ready to fire. We cannot relax. We try to lay down at night and our brain is just going, 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 because we have not really learned how to activate our parasympathetic system, which is our rest and digest. And that's that place where we can recover, where we can relax, and where we can start to heal. But when we're always have a fire alarm going off in our head, trying to solve a problem, trying to fix something, well, yeah, your body is going to tell you what's going on. So sometimes our pain has nothing to do with the region where the pain is. It's just
Mm,
our body our brain screaming at us through our body. Like, so I always say pain is pay attention inside now.
mm,
There's something going on. Why? Because pain is the last thing that shows up and it's the first thing that goes away. So
the
your
truth.
body's been under chronic stress for months, maybe years, right? We always say stress is a silent killer. And then all of a sudden, it's the reason why someone can have cancer and not have any pain. And then all of a sudden they're like, oh my God, I'm having this pain in, this certain region. And this is just kind of a blanket statement. This is not across the board, but they can have cancer and not have pain. Pain shows up at the last minute. Well, by that time, we're looking at stage 3 or maybe a stage 4. And they go, well,
Mm-hmm.
how did it get this far? I didn't have any pain. That's because our brain doesn't allow us to feel every single level of pain. It will try to handle it on its own. And then when it gets to the point where it's too much, it's like, here's pain. It's like, okay, I'll give you a perfect example.
Mm-hmm.
You ever stub your toe or
Yeah.
you hit yourself and you're like, I'm not going to look at it. If I look at it, it's going to hurt. You're like, I know it hurts. You hit that, and then you look down and you're like, oh, now it hurts even worse because now
Mm-hmm.
your brain recognizes you see it. That's how pain works. And so once we are able to acknowledge it, then we see, oh, that does hurt. So a lot of times with patients, I'm working on them. They have no idea that they're in pain or this region hurts. And I start touching and aggravate. I didn't even know that was a problem, doc. And I'm like, yeah, well, I do. I can feel it. It's there. Yeah, it doesn't bother me. I'm like, yeah, but it will one day. So let's get it gone before it becomes a problem. And that's what I try to teach people is we don't have to live with those trigger points and that pain inside of our body. But a lot of times it starts here. We call them mental subluxations, right? So we have to clear the brain out. We have to do things to bring our stress levels down if we want our body to heal. It doesn't work they go hand in hand. So you can't fix the body without fixing the mind. So,
Love that. Love that.
mhm.
Love, 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 love it. So, my question is this. Let's say we're talking to a bunch of couch potatoes.
Okay.
We may not be, but let's just hypothetically say we're talking to a bunch of couch potatoes or people who just love to just go home, crash, doom scroll, all the things where you know that you just made it through work for the day
Yeah.
and that's good enough for you. But how can folks like that start to prioritize movement
Okay.
to not only mitigate stress, but also to keep the pain away or to even manage pain? Because,
Mhm.
to be very real, there are people that are laying down right now in pain. Not understanding that the movement, getting that cortisol down, getting that stress down is actually going to be able to get you to relieve said pain. No, you
Yeah.
don't have to go home and pop, Advil and Tylenol, but there are things that you can do. Please tell them what is it that they can do today to be able to say, you know what, I'm going to get started. I really want to work on movement. I don't want to be 50, 60, and 70 with this getting rapidly worse, and I'm hearing now I have to have hip surgery. And let's talk about preventative measures, because I love that you said pain can go away. You
Yeah.
can reverse that. And that's pretty powerful. So I want people to know that if they're feeling pain right now, there is a way that they can reverse that. What what
Yeah.
what can they do?
Yeah. So, and everyone comes to pain at a different point, right? So for me, I meet people where they're at. I have some folks who have conditions where they're in chronic pain, and that's going to be a little bit more difficult. If they are experiencing an autoimmune disorder that causes chronic pain, that's a lot different than someone who's carrying around stress in their shoulders, neck, or low back, or knees or hips. So I want to make sure that I separate the two of that so that those folks who are listening that might have that kind of disorder aren't feeling like, oh, well, this is my fault. It's not your fault, right? Their body's going through something. And so as practitioners, it's our job to meet them where they're at. For everyone else who has a normal, healthy lifestyle, they go to work, they don't have chronic health issues or an autoimmune disorder, doing little things daily rewards our brain, right? So our brain searches for things to make us happy every day. It's the reason why we like sugar. It's the reason why as a society we like alcohol or drugs or whatever other thing that rewards the pleasure center of our brain. But exercise does that too. So it allows us to have that dopamine release and give our body a natural high. So once we start working out, we feel good afterwards. We're like, that was a task that we completed and our brain is now happy. Good job. Like I'm tired, but I feel satisfied. Most people don't leave the gym and go, now I want to go have a milkshake because they don't need the sugar because their brain has already the dopamine that it needs. Or they're not going to have whatever other vice that may be rewarding that pleasure center. So we can find rewards in exercise, sometimes just even doing deep stretches. Now, the caveat to that is if you have someone who's never done anything or they've been sitting on the couch for years at a time, one new thing every day is enough. It doesn't have to be a full routine because you're going to come into a place where you get to burnout. If I said, go do a whole exercise routine for an hour and a half, you might do it a day or two. And then afterwards, you're like, I don't want to keep doing this. So if I gave you 2 or 3 exercises to stretch and a strength, and you're like, oh, that was easy. I feel good. I could do that again tomorrow. And then the next day, I could do it again tomorrow. Oh, this is easy. Now we add in something else. So it's taking small, actionable steps each and every day, a conscious choice to do something different for a greater result. And it could be something as just sitting on the floor. I have patients, they are very much couch potatoes. And so I give them couch potato exercises. Why would I change their routine? Why would I try to get them to go to the gym? They haven't been 5, 10, 15, 20 years. I'm not going to get them to change that. So let me give them something they can do while they're sitting on the couch. Okay, let's make it easy for them. And so that's a really easy way to get people started. Again, meeting someone where they're at is very important versus trying to take them someplace they've never been. It's a path, right? So feeling it's a marathon. It's not a sprint. It just takes a little bit of time. And we do it slowly. We take it step by step. I like, if they're scrolling, I say set a timer. If you're going to scroll, then put it somewhere where if you're going to scroll that you're not looking down at your phone, right? That's a big issue for us right now as a generation. Our kids and even the adults, we're in this position looking down at our phone. That's horrible for us. So we have to do a better job of bringing our phones up to our face, even lying on our back and looking at our phone. There's little things that we can change daily. If we spend the day at a computer hunched over this way, we need to spend a little bit of time at night laid back this way, right? So just little changes, small changes each and every day. Again, everyone does and needs something a little different, but they're not hopeless. We can make it work.
Absolutely. I am curious. I want to know what those couch potato exercises are because I've never heard that before. I feel like I just learned today that those two things can exist, that you could be a couch potato and exercise, as far as, really managing that pain and movement. So
Yeah.
I'm curious. I would love to know, give me one or two exercises that you could do as a couch potato. This is actually pretty interesting to me.
Okay, so I'll use low back pain as an example because I think the statistics are over 80% of Americans experience some type of low back pain within their lifetime, right? And more as we get into our 30s, 40s, and 50s. And a lot of that comes from having lack of core stability. So we think about core, and most people think 6-pack, 8-pack abs. Nah, that's not it. It's just having a nice, stable core so that you're not using your low back muscles to do all of your movement, and your core is strong enough to hold you up so you can continue to do movements. So a lot of times when we say, well, let's do some core workout, people think planks or sit-ups or something crazy like a mountain climber. Okay, that's like level 5. We don't have to go there to start. We can sit at the edge of our couch and just do leg lifts just very easily. We can do chair exercises if we're sitting down and just march in place, bringing our legs up and down. Those kind of small movements make a big difference. Especially if we have someone who's a senior citizen. They can sit on the side and rock side to side. Those things and just sitting on the edge of the couch. So, we're not trying to change them today, but we're going to do small little steps every single day to get them where they need to be, especially if they already have mobility issues. Trying to get a 78-year-old on the ground who can't get up from the ground is challenging. So you got to keep them on their bed or their couch. I have them, if they have a higher bed or their couch is a little higher, I have them do squats on their couch. They get to go down and come back up. Sitting and standing without the use of their hands is one of the best things you can do for someone. Most people do not realize that when they go to stand up, they're pushing off of something instead of using their legs to do it. So I encourage them, scoot to the edge of your couch and stand up with no hands. That right there is enough. That's a good place to start. Once we can get them stable and they're able to just stand up from the couch without using and pushing off, great. Now we can increase it. So it's little small things. And I show patients in the office, my table, it raises up and down so I can get really low or really high. And I usually find the place where either their bed is at or their couch is at, and we'll go to the edge of the table. And I'm like, let's do a little bit of a workout. And they're like, I can't get on the ground. I said, I didn't ask you to get on the ground. Just asked you to move. Let's just move from right here. And usually within about a week or two, they're like, that's easy, doc. Can we get harder? Because now I rewarded their brain. They checked the box that they didn't think they could check because we overcomplicate exercise at the beginning. And that is what turns people off, why people don't like to do it. We're like all or nothing. That's not how it works.
I'm glad that you said that because a lot of career women listen to this podcast. Based on our analytics, we are seeing that women are definitely busy women, so they
Hmm.
don't always have the time to
Right.
get to the gym. They don't always have the time. By the time you get home, you're ready to crash, and then you
Hmm.
have the second half of your life. Whether you're a mother, whether you're a wife, whether you're a sister, daughter, friend, like the list goes on and on and on. A caregiver, to aging parents, whatever that looks
Right.
like. Sometimes we don't have the time. And then we did a sleep episode, and some women don't want to get up 5, 6 a.m. because they went to
Right.
bed super late doing what they needed to do. So just hearing that alone is phenomenal, that you can really just do those things at home to just relieve stress, relieve pain, move a little bit, and then you start to gradually get better. What I love about the human body is that as long as you talk to it, listen to it, give it what it needs, it answers you back.
Yes,
And
it
I
does.
think just hearing that you can just really reverse pain. And it's like, okay, we'll just get rid of the pain. Okay, we'll lose the weight. Okay, you lowered your cortisol. We'll make it like, okay, you're taking your supplements. Now we can start growing your hair. Whatever it is, your body listens to you. You just have to listen to it as well.
One of my favorite things for busy, so you can do things, like I said, on the couch. You can do them at your desk. My other favorite place to get a good quick workout in is the shower. I
Mm.
love the shower. I do a lot of shoulder, wall arm bars, exercises, shoulder mobility, scapula mobility things in the shower. If I have patients who are like, I sweat a lot, I'm like, great, do it in the shower. It's the sweat off. And like, I'm tight. I like when I work out, when I use the heat before, great, do it in the shower. I don't have time, but I do take, and I ask, okay, you don't have time. How long do you take a shower for? I'm like 20, 30 minutes. I'm like, great, I only need 5 minutes out of that shower.
I love that.
So the shower is a way we can add it in. I love finding loopholes in people's lives, because
Mm.
if we find the loopholes, then we can make it easy, and then they start incorporating it into other aspects. But the shower is one of the easiest places you can throw a quick. I don't suggest lower body just because we don't want any slips and falls, but upper body things, absolutely in the shower for sure.
That's amazing because one of the things that we always hear consistently throughout, most of our episodes is that doctors recommend doing audits. And then when you do the audit, you will find where you can fit in the things that you think you cannot fit in. So being
Mhm.
able to just incorporate movement in the shower, movement on the edge of the couch, movement at your desk, but it is
Mhm.
possible. It's just us to be cognizant of it, to say, you know what, this is where I'm going to take this 5 quick minutes. And I find myself doing that sometimes. Sometimes I'll be at my desk and I'll just get up, sit down for like 10 times. And then I'll sit back
Yes.
down and get back to typing. Like, I just know that you're sitting right here, Laura. You can still stand up, check an email, sit back down. You can
Yeah.
still do it. So, yeah. And I think that it does help. It really does help. And then I noticed that when my Apple Watch is on, it's literally like, oh, you met your stand requirements.
Yeah.
I'm like, yeah, because I'm doing it as much as I can, because
Right.
I am constantly working. So I think that that's just so amazing. I love what you talked about. Please, if there is one thing that everyone can take away from this episode about movement, fixing pain in their body, and just making sure that they have this beautiful progression toward longevity in their older age, what is that thing?
So, I'm a chiropractor. So, of course, I'm going to lean towards spinal health, right? Spinal hygiene is one of my favorite things to talk about. We don't think about checking our spine or our joints as often. We think, exercise and physical therapy or personal training. But I encourage people to find a chiropractor that looks like them, that's in their neighborhood or in their community, and have their spine checked, right? A lot of those things require our functions every day. So, our organs, our joints, nothing moves well if our spine doesn't move well. So if our spine's not lubricated, we can't move left or right, we can't bend over. Everything starts with how our spine is moving. That doesn't mean that they have to prescribe to some long care plan with chiropractic for the rest of their life. But I will also say to that, you're going to go to the dentist for the rest of your life and get your teeth checked,
Right.
because you want your teeth, and your teeth are important, but your spine controls our nervous system. It houses it, it protects it. So I encourage people to have their spine checked, make sure they have good spinal hygiene, and pick one thing today to do different than you did yesterday. Just add one piece of it in, whether that's a stretch or a strengthening activity. Just start with one. You could pick two if you like, one stretch and one strength, but start there, get easy, and then continue to add it. Don't overthink the process. Our body loves to move. We were designed to move. So we have to get outside. We have to move and go touch grass because grass is
I
very
love
important.
that. That's so good. And I just want to touch on that. I'm so glad you said that because that's how you and I connected because you were able to, you taught me about spinal hygiene when you worked with our team and you did the article on spinal hygiene. I said, when it came past my desk, I said, well, what is this about? I never heard of spinal hygiene before.
Mm-hmm.
So that was pretty great. I didn't even know about that. I mentioned that episodes ago about the fact that you were the one that said, learn about you taught us about spinal hygiene. And I'm just like, hygiene, we always think it's our bodies, right? We're always like, but no, there's actual spinal, and then we learned there's sleep hygiene. We learned so much about the term hygiene being tied to certain things in our body, and spinal hygiene was one of them. I love that. And that was a really powerful article, you contributed to for Lushness on spinal hygiene. I thought that was really great. So yes, I love that as a takeaway. That's a really
Yeah,
good takeaway. So Dr. Jackson, I want to thank you so much for spending time with us today,
absolutely.
really just telling us what we can do to change our bodies. We can always go deeper into movement, but I think this just gives people the hope and the understanding that they can reverse pain. They don't have to
Mm-hmm.
live with pain.
Mm-mm.
And I think hearing that, understanding that we just lower our stress as best as we possibly can and really start to see some change in our body, I think that's a word in itself. Thank you so much. Is there any last words?
No, it's my pleasure. Thank you for having me. I love your community. I love us. I love you. I love what you're doing. I'm so proud of you. And this is amazing. And I'm love that we are continuing having these conversations. They're very important for us to have as a community. There's so many things that we can hold hands with each other and push through. We don't have to do this alone. And you're creating a beautiful platform for that. So thank you for having me.
Absolutely. Thanks again.